once again, these are not guidelines. This is just ways in which one might approach a condition in a primary care setting. In regards to hematuria, what will happen is that you will order a urine test, urinalysis test for different reasons, or during a physical, and it will come back positive for occult blood. And the main concern is that if anybody had a history of smoking or secondhand smoke exposure, you want to make sure that they are referred to the urologist to rule out bladder cancer. You also ask if they had the period around the time when they did the blood work, because that could have contaminating the urine. You also ask about UTI symptoms such as frequency, urgency, dysuria. In that case, that could be the reason for the hematuria. You also ask about symptoms of pyelonephritis, or such as vomiting, fever, flank pain. And also you can ask about symptoms of kidney stones such as flank pain and lower back pain in the flank area, or frank hematuria. Um, so that would be the initial approach. So what do we do once we see it coming back? So we repeat the urine, but I would repeat it with culture sensitivity to rule out any infection. If there are symptoms of UTI, you might want to consider treating the UTI empirically and then do the culture sensitivity also at the same time, just to make sure you are killing the right bacteria. And I would say to increase lots of water, just to make sure that if there's any kidney stone is flushed out of the body. And if there's any risk of UTI that is not there yet, you prevent it by drinking a lot of water and increase urination. Later on, you want to repeat the urine. You might want to repeat the urine, but to be done 10 days after the period, just to confirm that the hematuria was transient and it is not there any longer. And you might want to, if it's still come back positive, you might want to do a renal ultrasound. And the reason you want to do a renal ultrasound is to rule out any renal cyst, which could be the reason for the hematuria. If you want to rule out a kidney stone, then the exam that you would do is a CAT scan of the abdomen and pelvis. That would be the way you rule out a kidney stone, although the ultrasound can also pick up on kidney stones. But the CAT scan of abdomen and pelvis, that's the way the test you would do to rule out any kidney stone. But in any case, if there's hematuria coming back, you consider referring the patient to the urologist, because they could order this test too. They could order renal ultrasound, rule out renal cyst, because even if you do the renal ultrasound, if it comes back with a renal cyst, you want to make sure you send it to the urologist, not the nephrologist. Any renal cyst that comes back on a test, you refer them to the urologist, not the nephrologist. The urologist is the one who takes care of renal cyst. Also kidney stones, that's also a urologist referral. What happens is that the renal cyst, as it grows, it can put pressure on the kidney, and it can damage the kidney and cause bleeding, and it can even lead to renal failure. And that's why you want to make sure that if there's any positive hematuria and you want to refer them to the urologist to further evaluate the situation. But if you do a renal ultrasound ahead and it comes back with renal cyst, you want to make sure that you refer to the urologist, because renal cyst can lead to renal failure. And other causes to consider that might cause blood in the urine or hematuria are, as we mentioned before, heavy menses. There might be contamination, polycystic kidney disease, which is just another the name that for condition when you have renal cysts around the kidneys that cause problems in the kidneys. If you're taking blood thinners, that can also cause hematuria. Heavy lifting due to straining can cause hematuria, and even just straining when you pee can cause hematuria, or scar tissue in the urethra. So the bottom line is that if you ever have hematuria, you just don't want to leave it like that. Don't ignore it. You want to do other tests just to rule out the cause of it. But especially if somebody has a history of smoking or secondhand smoke, you want to make sure that they are referred to the urologist.